in 2014 they introduced these things called the home care packages, which is a sort of there's 4 levels of home care packages that are delivered to the person. So it's a budget of money that you can spend however you like on your own care, to keep, or on whatever goods and services you need to keep you in your own home. And I think a lot of people don't understand how that system works. Again, it's been it was badly rolled out, and it's only just starting to sort of sort itself out. There's a 6 to 12 month wait for a home care package, and 120-odd thousand people waiting for a high-level home care package. So there's high demand, and I think the government was, underestimated what demand would be there. But I think once that sorts itself out, and when people do get assigned a home care package, it can go a long way to keeping them at home. It's unfortunate that some people leave that too late to both apply for one and therefore get assigned one. And often people are having to move into residential aged care probably earlier than, unnecessarily. Either that or they're dying before they get a home care package, which is awful. You're assessed for a home care package by what they call the Aged Care Assessment Team. It's a government organisation with healthcare professionals who come and talk to you about your needs. They go away and prioritise and give you assign you a level, 1, 2, 3 or 4, 1 being the lowest level of care and 4 being the highest. And what that essentially does is make you eligible for a budget, a package of money that's assigned to you. It's administered by a provider, so some of the big names that people might recognise are IRT or Baptist Care or Kin Care, or just to name a few, but there's literally hundreds and hundreds of them around the country. So they take responsibility for that money, and they assign you a case manager, and you talk about the care and services that you might need. So a level 1 package is probably worth about $8,000, and a level 4 package is about $54,000 a year, which you may or may not be asked to contribute to. It's income tested, and there's also a basic care fee. So the government does ask you to make a contribution towards that, but it is income tested. There isn't what they call an entry-level care service provision. Again, highly subsidised services delivered by government-sanctioned providers called Commonwealth Home Support Program. So if you haven't been assessed for a home care package, but you know you need some help, you may have access to this sort of what they call sort of ad hoc entry-level services. And if you're on quite a they cut out as soon as you get offered a home care package, unless you're on a high level package waiting for more help. Then you can sort of tap into this other service. So I think the take home message is that the help is probably there somewhere, and people shouldn't wait until the absolute last minute before they need it. Understand where it is and how to access it before you need it. Because there is a huge shortage of workers and services, compared to the demand.